A burning sensation, an itch that will not go away, a rash, yellow or brown or white discharge. For many teenage girls and young women in South Africa, these are things that you do not talk about. They are symptoms to hide from friends, from partners, from parents, and even healthcare providers. Ladies and gentlemen, today we are joined by Dr. Zoe Duby, or Zoe as she prefers to be called, who comes from the South African Medical Research Council. We are talking all things sexual reproductive health of young girls and women. Dr. Zoe, welcome to Beyond the Headlines. How are you?
Thank you for having me. Good afternoon. I'm very well, thank you. And how are you?
I'm doing absolutely well, except it is very cold in Port Elizabeth, or Gqeberha as we call it now. It's been raining for the past couple of weeks, and it keeps getting worse. But we are
I'm sorry to hear
surviving.
that.
Before we start, could you please just let me and my listeners know who Dr. Zoe Duby is?
Sure. So I am a socio-behavioral social scientist. I work with the South African Medical Research Council. I am a senior scientist in the Health Systems Research Unit there. I have been working in the field of sexual and reproductive health for about the last 20 years or so. And my focus more recently has been on the sexual and reproductive health of mostly adolescent girls and young women. But I have a background working with various populations, specifically people who are most at risk or most vulnerable populations. But I'm passionate about health equity, about access to healthcare, and really about exploring and challenging some of the social factors that make people more vulnerable or make certain people more at risk, and sort of challenging those assumptions that we make in our society.
Hmm. Uh, why particularly sexual reproductive health among girls and women?
So the focus around adolescent girls and young women, well, because I work in the South African context, adolescent girls and young women carry the highest burden of HIV in our country. So they have a much higher prevalence than males of the same age and of than other age groups. So they are more at risk than anyone else in the general population. And I'm also, our projects also focus around pregnancy amongst young women. So many young women in our country get pregnant without intending to, and that has many consequences, obviously, for their education and for the rest of their lives, really. So sexual and reproductive health is kind of tied up and linked to everything else. It's linked to mental health, it's linked to education, it's linked to career opportunities. It's just a really crucial aspect of well-being. So that's sort of quite a holistic view of sexual and reproductive health.
I see the link to mental health, but how does it link to education?
Well, negative sexual and reproductive health outcomes. So whether you are infected with HIV or you have an unplanned early pregnancy, that is going to impede your ability to access education. So many young women, for example, get infected with HIV. They don't realize they might get ill, or they may end up on treatment. They've got to access their treatment. They've got to go into healthcare. Or they end up as young mothers, and if they don't have assistance looking after their child, then they drop out of school, and that's what we see with the majority of girls who have an early and unplanned pregnancy. So, school completion is an issue, and just general health opportunities and career opportunities are affected by these issues.
Hmm. That's interesting. When I first started, I read out a title from Daily Maverick, I think. It's an article of yours that I came across where you had written about shame. I think that young girls would sort of like, I'm not sure if possessed would be the right term in this case, but relating to their sexual health. And I then went online to look at some of the other works that you've done previously, and I see it cuts across various themes, shame being one of them, but also silence around sexual health. You also focus on the importance of trust in, I would say, in safe spaces and the social realities of adolescence, as you've just mentioned. But I think what was interesting for me was to see, and tying it to what you just mentioned now, that you particularly focus on young girls and women. And I wondered why you don't particularly focus on men and why you don't particularly focus on young boys.
Mm. It's an incredibly good and incredibly pertinent question. So the projects that my group have been involved in evaluating projects, which are the objective of those is to address some of these negative health outcomes. Now, the reason that funding has been focused around adolescent girls and young women, as I just mentioned, HIV prevalence is much higher amongst young women than amongst boys of the same age. Teenage
Mm-hmm.
pregnancy is a huge issue. But obviously, there have to be males involved involved in these pregnancies. But what we do know is generally these young women are having male partners who are older than them, so they're not the same necessarily in the same age group. And the funding focus for health programs has primarily been targeted at young women. So the evaluations of these health programs that we have come in to do have focused on the beneficiaries of these programs. In some of our studies, we have spoken to male partners and male peers of the young women. In general, we've found it quite difficult to access them for research purposes, but it is definitely something that we have been increasingly concerned about and really wanting to work with young men. So some of my colleagues who have been working in the school environment have increasingly been trying to work with young men in programs, particularly around violence, sort of violence prevention and initiatives. But we would really like to increase our work with young men because a lot of the issues are related to gender norms, gender expectations, risk, and the young men are a really important part of that component. But so far we haven't yet been able to get funding to work with them. So that's the other issue.
Hmm. I suppose that makes it provides a bit of clarity on my end, and one must say thank you for the wonderful job that you and your colleagues are doing. I always ask myself, especially when I watch news or when I read articles, uh, why certain words are used or why certain languages or expressions are used. When I read an article on Daily Maverick, you particularly use the term "it's burning down there," and I wondered why you would use such emotional words.
Thank you. So the Daily Maverick article you're referring to was a republication of an article I wrote for the Becca Cisa Health Journalism Group, who I've been working with
Mm-hmm.
quite a lot. Um, and the specific quotation, "it's burning down there," was a direct quotation from one of the young women we spoke to in the interviews. So I am a qualitative researcher, and I do qualitative work where we gather people's real lived experiences and we capture their voices in our research. So we don't look, I have my colleagues who do more quantitative work, so they look more at statistics, they do surveys, but my work is all qualitative. So we really try and capture the narratives and the stories of young women. So that quotation was directly from an interview with a young woman who said, "It's burning down there." So that's why
Mm.
we use that terminology, because we think it really helps to articulate young women's voices themselves and use the language that they use.
Okay, I think that's important, especially when you are doing qualitative research. It's important to take note of such things. But I would want to stay with that specific woman whose words you borrowed when you were crafting this article and when you were obviously publishing your paper. Uh, what was her expression like when she was giving a narrative of her experiences?
So our interviews are not video recorded, they're audio recorded with participants'
Hmm.
consent. We have the interviewers who are trained, obviously, to capture the emotions of participants. This specific quote was in reference to young women being asked about their knowledge about STIs, sexually transmitted infections. So that specific quote was from a young woman who was in the age group 15 to 17 years old, and she was in the Western Cape site. And she was speaking to her lack of knowledge, and that's all that she has, the only time she's communicated about sexually transmitted infections or vaginal infections with someone else has been in reference to say, something is wrong, it's burning down there. So
Hmm.
that's it was an example, an illustrative quote of her lack of knowledge of what might be the issue, but then this was a sensation that indicates that something is wrong.
Hmm. Okay, thank you for that. But I saw also a part that highlights on the number of girls that are diagnosed with STIs. I think 1 in every 5 girls are diagnosed with an STI. And I would love to hear from you as somebody who works on such topics, um, on what you think this means about hidden sexual health, especially in South Africa.
So what it means about hidden sexual health, did you say?
Yes.
Right. So it's a big, it's a big topic. So part of what we were focusing on with this paper, and also with the article that we wrote with Becca Cisa, which had been picked up by other news outlets, was really to try and bring some of these conversations into the open, because
Mm,
we know that when young people, and so not only young girls, and actually young men are perhaps even more at risk of this, but is just not talking about their sexual health. So we know that there's a big communication gap between young people and the older generation. So whether those are parents or caregivers, in many communities and cultures, not only in South Africa, in the sub-Saharan African region more generally, there are taboos around talking about sex and sexual topics. So when they are spoken about with unclear language, maybe with euphemisms, with words that are, designed to be indirect because it's not seen as culturally appropriate to speak explicitly or openly about the sexual organs, about sexual behavior. So it means that young people are not given the tools with which to speak about their sexual health. It's not a topic that is regarded as appropriate to talk about. And even amongst peers, young people are embarrassed to talk about their sexual health, their genitalia, for example. Um, so there's a real silence when it comes to communicating about these issues. So many young people, if they are experiencing some symptoms, they are too embarrassed to seek help. They are too embarrassed to seek care.
mm,
And coupled with that is the issue that, if these are sexually transmitted infections, there is an association with promiscuity, with maybe that people assuming that you are very sexually active, that it's saying that you are having many sexual partners. So, young people are too embarrassed to even acknowledge that they are sexually active. But then now, if you have an STI, people might make assumptions about you. We saw that with HIV, people being labeled as promiscuous, and that's a real danger. And that we saw with young people scared of even telling a nurse or a healthcare provider that they have
mm,
an STI because they are worried about being labeled or judged by that healthcare provider or by people around them.
But wouldn't you then say that culture is a contributor to this shame that you write about? Because if
Yes,
people,
definitely.
yeah, please go on.
I mean, it definitely is. And, I'm not saying anything is, we never want to point fingers at
Mm,
cultures or traditions at being right or wrong, but to look at the implications. So some of our work has, we've spoken to parents as well who say themselves that, I do not discuss sexual topics with my children or my adolescents because it's too embarrassing. I wouldn't know what to say. This is inappropriate. I don't want them even to be sexually active. So why would I want to talk to them about how to make themselves safe? So there are many issues that are specific to, cultural context. That it is just deemed adolescent sexuality is seen as something that is taboo, that is inappropriate. So there is this denial amongst the older population that young people actually are sexually active and that they need this information.
and when you dig deep, when you conduct your studies, especially with now women and not so much young girls, why is it that they hold this sense of fear, this strong sense of fear and secrecy, if I may, to an extent that they can't even talk to healthcare workers? I do see friends and partners, but to the extent that they wouldn't even be able to talk to healthcare workers? Why is that?
So, I mean, there's a few reasons, and one, as I indicated, is that women are scared of being judged for being sexually promiscuous or having multiple partners. They are worried that this might be a sign, that they might be judged by a healthcare provider, particularly perhaps if they are unmarried. There are a lot of healthcare providers in this country, and I'm not going to point any fingers about blaming, but
Mm,
they're often nurses have quite conservative views. They may be older women, and they may have specific religious or cultural views, which they ideally shouldn't interfere with their health provision, but we do know that is the case. And sometimes women are too scared to disclose their sexual behaviors, and we see that with people of different sexualities. They're too scared to disclose perhaps that they have a partner of the same sex, or they're too embarrassed to disclose they have multiple partners, because there is unfortunately a lot of judgment that does come from healthcare providers. So
mm,
um, it creates this culture of silence. And also, if we look at community health centers that are in communities, because they're important that they make healthcare accessible, but sometimes it might be your neighbor who is, in the waiting room next to you. The nurse might know your auntie. These small communities, particularly in rural areas where everyone
mm,
knows everyone else, and so there is this fear that their confidentiality might be not be maintained, and someone else might discover what you tell the healthcare worker.
mm. Zoe, I was gobsmacked sometime last year. I had a conversation with another lady who is from the Bakwena Bakgopa Foundation in Northwest, and we're talking about the issue of males raping women. And to my surprise, women, especially in rural areas, don't even report when they are raped
Mm.
because of cultural influences, because of the stigma that you speak of as well. So they have to hide in shame for the rest of their lives. I wonder
Mm.
if you've experienced something like that.
So my focus hasn't been primarily on sexual violence, but unfortunately,
Mm,
given that it is so prevalent in South Africa across the country, we have spoken to many young women who have been sexually assaulted or abused, and often they are too scared to speak out, or they don't have the confidence to seek help. Often, the perpetrators of the violence may be relatives. And
Mhm.
that is, makes the fear and the silence even more of an issue. They are scared of creating conflict in the family, or they're scared of the repercussions of disclosing the violence. And many women, many young people, that they don't have access to social workers, or they don't even know how to access a social worker. So there is a lot of issues around even about mental health, in addition to violence, of people just not having the tools to articulate how they feel or articulate their experiences. They feel very isolated or alone. And we found that, we it's referred to as a lack of psychosocial support. So
Mm.
women, young people, teenagers, they just don't know how to seek help. So whether they are depressed, or they've had a sexual violence incident or some kind of bullying, they just don't know how to verbalize what they're going through, and they don't know how to seek help for that. So I think it's an issue across the board, that there is, not only young people, but people, really need to be equipped with the skills to speak about the issues they're facing and to seek help.
Looking at South Africa, I mean, we are highly progressed, I always say, even though we are still classified as a third world country. But why do you think we experience such things in the country? Yeah, why is there shame around sexual health? And maybe tied to that, and something I think is not particularly your focus area, but I think you do touch on it. Why is it that we are seeing uh, rape cases spiking each and every year?
Mm. Well, I think it's a very complex issue. So yes, you speak about South Africa being sort of socioeconomically developed or advanced, or whatever terminology you want to use. But we also have a huge amount of inequality and poverty in this country. And so, one wonderful thing about South Africa is that people are very in touch with the diversity of cultures, of religions, of ethnicities. So there is almost we see that with traditional medicine being very strong still. So there is a sort of biomedical sector with hospitals and sort of more Western science, but people also there's a very strong support for traditional medicine. So it's called medical pluralism, where people might
Mm,
have multiple medical beliefs. So they may also, they may be taking a quote unquote scientific medication, but also taking a traditional, seeking help from a traditional healer. So people have these kind of diversity of beliefs. So that just shows that there is this sort of duality between the modern science as well as this kind of traditional belief system. And I think there are a lot of aspects of cultures and traditions where gender plays a big role. So you ask specifically about violence.
mm,
And one thing that we know in South Africa and more broadly in the region, that in many communities, men still hold a lot of the power in decision making, particularly in relationships in the household. Women and that is one aspect that is related to sexual violence. So women are often disempowered. They cannot negotiate the terms of their relationships, of their sexual encounters. Even in the household, men are the ones who make decisions about the household economics, for example. Um, but coupled with that, we've also got hugely high rates of poverty, of unemployment. So I think,
mm,
and we have this quite recent history of apartheid and of a lot of disadvantage. So I think you have a huge number of men who are feeling themselves very disempowered. Perhaps they are unemployed, perhaps they are. Um, we know that often men turn to the use of alcohol, other substances, because they're feeling depressed about their lack of work, perhaps their lack of economic opportunities. You have a lot of inequality. So I think it generates this whole mix of, men who are feeling disempowered, who are feeling perhaps angry, who are feeling frustrated at the lack of opportunities available to them, particularly in lower socioeconomic communities. And that frustration is taken out when they drink. And we know that South Africa has very high rates of alcohol use and problematic alcohol use amongst both men and women. And that is also related to violence. So I think it's this big melting pot of issues that are all related, and a lot of that manifests in violence. But yeah, it's very
Hmm.
complex.
So I will start from where you ended. You talk about the lack of opportunities for men and how that sort of like changes behavior. Now, I think I've said this in this very same platform that I always worry when I see bursaries that are only geared towards women and jobs that specify that they are for women, and I know it's for redress purposes, but I always ask myself that aren't we reinventing what has happened before rather than addressing our mistakes? I say this because I think that the same anger that you speak of is what we are likely to see for the many years that are yet to come, because men are in deprivation now. And so the only way that they're going to fight for survival is through, I would say, their physical strength in this case, or they're going to be violent. They're going to fight in order for them to be able to make a living. Not
Mm.
just in the context of what we are talking about, but in all other areas of life, I would argue. And we are going to likely see issues of rape being topical for many years to come, if that holds true, and there's nothing being done about it.
Mm. I mean, I agree with you, and I think that, there has historically women have been more disadvantaged in education. They have been fewer opportunities for women in the workplace, but that has been changing. And the same way that you have, I've also seen a lot of these um, bursaries and funding available just to women. And I think that that is my view is that we are realizing that this is a tipping point and that has to change. And I do see that
Mm.
in more, sort of job adverts, for example, that men, I think targets are beginning to shift, where primarily it was women who were being given opportunities. From what I have seen, I think that is changing in recognition that, we actually now need to focus on men as well, because women have been given these opportunities. So I think that, I don't think that sexual violence and rape is just an issue of I think that's a contributing factor. I think there are broader
Mm-hmm.
gender norms which also need to be addressed around masculinity and young men. There's a lot of work to be done with young men and young women just to really get young people to think about what a healthy masculinity looks like. It's not about violence, it's not about power, it's not about power over a woman. And I think that's something that we really, as a country, need to focus on, because that will be an issue. And you've got these young men who are unemployed or they are frustrated, and they will turn to violence. And and you combine that with alcohol and other substance use, and it creates a very toxic situation.
But you also mentioned that we see some of the things because of poverty. You didn't expand on that, and you said poverty and unemployment. If you could just elaborate, please, I would appreciate that. I'd love to know what the correlation between the two and sexual health is.
Mm. So I'm not an expert on sort of the economic side, but from what our work has, what we've seen in our research is that, for example, one of our studies looked at mental health amongst, and this was amongst adolescent girls and young women again. And we have what are called mental health stressors, so aspects which um, create psychological distress for individuals, and poverty and household food insecurity are key mental health stressors. So when you are
Mm.
not sure where the next meal is coming from, you have unemployment in your household. So you have the adults around you who are themselves stressed and worried. Um, there is, there's no security in the household as to anyone is bringing in a salary that can pay for household costs, for groceries. So you have this stressful environment in the household, combined with perhaps hunger, combined with perhaps not being able to focus on your education because there are these competing um, priorities. And it creates these situations where young people are more likely to take risks. And we have seen, for example, that young women are engaging, many young women are engaging in transactional relationships in order to, meet their material needs, their material desires. So, poverty not only creates these situations where mental health is impacted. So young people are feeling very stressed by their environments, and the adults around them are also feeling very stressed. But then it also can contribute to increased risk-taking behaviors. So that's kind of where we see this link emerging.
Hmm. What are transactional relationships?
So transactional relationships, so we define it as differently to sex work. So sex work is selling sex for money. It's a very clear economic transaction.
Mm-hmm.
Transactional sex is defined as, or transactional relationships, it's engaging in a relationship in exchange for not for cash or for money, but for other kinds of support. So it could be someone is buying you a cell phone. It could be that they are paying for your new haircut. It could be that they are buying you some branded tackies. So it could be, related to material goods. It could be they even paying your school fees. So it is a transaction that you engage in for something other than money. And many times we have the terminology around sugar daddies or
Mm.
blessers. So that's a transactional relationship. So this person could be paying your rent for you. They could be, buying you a nice car, depending on what level it's at. But it could also be that they are just buying you some groceries.
Okay, thanks for that. You're making me think because we've got a lot of young girls in universities. We see a lot of posh cars parking next to residences. In fact, there's usually some videos that circulate on TikTok and other social media platforms around girls that are being picked up by your sugar daddies and your affluent elders. And so this makes me think that with the rise of hunger in our education institutions, could it be that the reason why such even happens could be driven by the fact that the student is hungry in this case?
So we do know that food insecurity, as we term it, is
Mm.
related to higher engagement in transactional sex and transactional relationships more broadly. So I can't speak specifically to that student population. Um, what I think is important, and we've also sort of written about this distinction, because there are people who engage in transactional relationships to meet certain needs around just livelihoods, to survive. So they may be out of poverty, out of food insecurity, but also a lot of young women do engage in these relationships, not because they are desperate for food, but also because they aspire to a certain social status.
Mm.
So while there are those who really come, from the sort of the poverty aspect, there are also those who, many young women we spoke to see this as a way to gain social prestige. And so it's not about desperation, but it's about having a specific material their material needs met. And a lot of that is around, young people, adolescents, and, people in their early 20s. The approval of the peers and their peer group is very important to them. So they want to be seen to be wearing the right clothes, to, fitting in with a certain fashion. And that is so important to them that they, as a way to meet those needs, they engage in these relationships. So there's this kind of, it's just important to sometimes have a distinction between those who engage in these relationships out of poverty, and those who it's less of a sort of to meet needs. We say needs versus wants. So it's not necessarily just for things that they need, but rather things that they desire. So it's very interesting.
Yeah, one may want to look deeper into that. So I am in a university setting, as I'd explained to you earlier. What we see now is that there's a lot of food initiatives that are taking place around campus. There's even a university-wide committee that looks into the issue of hunger. And also there's a lot of sponsors for food in support of our students, because the hunger crisis is a real thing. But I don't think we've ever looked at this through this lens. It's always about a student must not go to the classroom hungry. And then we would marry that with the mental well-being of the student, but we would not take it further and actually look at it in a transactional relationship format. So thank you so much for this insight. I really appreciate it. But I want to move from there and sort of like get your feel on what role you think parents and families and maybe communities at large can play in breaking the silence around sexual and reproductive health of women and young girls.
Well, thanks. It's a really important conversation. And I think that there is a lot of work to be done with communities, and with parents and caregivers more broadly. And as I said, some of that comes from creating spaces for parents and caregivers themselves to be informed, to get the information, because many parents and caregivers themselves don't, perhaps they didn't finish school, they don't have high levels of education. So they don't feel equipped themselves with the information to give young people accurate advice or accurate information. So they're too scared to say anything because they're not sure if they know that they have the right information. Um, so there is a lot that needs to be done around equipping the older generation, particularly those, parents and caregivers, with communication skills, and teaching them how to engage in the positive parenting. We know that young people often, they don't want to be the ones to start the conversation with a parent. They don't want to say, Mom, Dad, I have a really embarrassing question to ask you. What is better is if the parents create opportunities for those conversations to happen. So having, encouraging this open, responsive communication about sex, so that they can overcome some of the adolescents' kind of embarrassment or discomfort. So providing information to parents, improving their confidence to speak about these topics is really important. And to really kind of try to show parents the impacts of their lack of communication. So, the current scenario is that young people don't feel comfortable to speak about these issues. What is the consequence of that? So as we've spoken about, young people then end up not getting accurate information. They don't have anyone to speak to. So, parents themselves need to understand that by not talking about this with your child, you are actually increasing their risk, because they have no one to speak to. They have no one to give them advice. And that's really important. But we also need to make sure we do that in a way that is culturally and contextually appropriate. So, that is sensitive to particular expectations in communities, because there's sometimes a lot of resistance, particularly amongst kind of religious communities, conservative communities. They say, we don't want to talk to young people about sex. It's going to encourage them to be sexually active. So we really need to be sensitive to those dynamics. And of course, do that in languages that are appropriate to the South African multilinguistic context, where we have 11 official languages. So we need to provide this kind of information in these programs in all the languages, and be very sensitive to the terms that we use to try and address some of this shame and stigma around sexual communication.
Mm. Mm. Thanks for that. I wonder how possible it is to do that justly. I just think of a case where we've got your Sotho learners studying in a different province like KwaZulu-Natal, for instance. How do you become culturally appropriate when you are dealing with diverse groups?
So that's a really one of the reasons why qualitative work, like the studies we do, is very useful, because you can go into communities and try to understand their specific context and their specific needs. You can't design one program and think that it will be appropriate across South Africa. So to understand the differences between communities, whether that's urban, that's rural, whether it's Sotho speaking, whether it's Afrikaans speaking, and speaking to different age groups and different settings. So that's really, it sounds, like it's a lot of work, but we have wonderful resources. We have schools are a really great environment for young people to kind of get this information. But we really need to understand the different kind of levels of need in different communities. And so we can tailor the information to different communities, different cultural settings, so that it is appropriate and it's acceptable to those different cultures and different community settings, so that people, acceptability is a big thing with the success of programs. And if you do something that is not acceptable to the elders, that is not acceptable to the traditional leaders, it is not going to be, you're not going to achieve your goals.
Hmm. And at the mention of schools there, what crucial conversations, especially on sexual health, would you say are missing in our schools?
So, we have this life orientation curriculum, which is, a national curriculum. It is a fantastic curriculum, and it's been designed with these kind of issues in mind. There are a couple of issues, though, is that, teachers themselves often don't receive enough training or support, and teachers themselves can be very too embarrassed to even teach the full curriculum, so they skip sections out, or they don't agree with them, or their personal beliefs might be in conflict with what they're teaching, so they actually just don't teach it. So it's a really fantastic format, but it's just not enough. Yeah, learners are not getting enough. So there are a lot of different ways we're trying to figure out how to reach young people with this kind of information and support. And there are programs that are trialing things like social media, WhatsApp resource bots, and chat bots. But you need to obviously there needs to be enough regulation to ensure that young people, because they are on their phones, they are on social media, and a lot of what they're seeing and hearing out there is inaccurate, and it's wrong. So we need to have really trusted sources where young people can get accurate information and advice. And yeah, I think school-based programs are a really helpful way to reach young people. However, we also need to be aware that there are some of the most vulnerable young people are not at school. They may be the ones who dropped out because of pregnancy or because of poverty or because of substance use or whatever it is. So there also need to be community level programs, and to figure out how to reach those youth who are not actually in education settings.
I just had a split second quiver at the mention of that, because you literally just took me down memory lane. When I was in school, I remember I was in grade 5. Our teacher was very, very much into teaching about issues concerning sexual health. But after that, I don't remember studying anything that had to do with sexual health in LO, to an extent that we ended up dancing and acting in LO, something that would otherwise be common in arts and culture. But then you also remind me that we used to have your healthcare workers coming to community halls, coming to school, especially high school, to teach about issues concerning sexual health, in particular HIV and AIDS. But what I think you mentioned in the article, and that I don't remember being touched on during those info sessions, as I will refer to them, is that there was not much mention of STIs or any other sexually transmitted infections. I don't know what the term is, but the focus was primarily on HIV and AIDS. So, yeah, can you please expand on why that is a hazard on its own?
It's very interesting, and I'm glad you. Well, thanks for sharing that memory. We also heard from respondents in our studies that they said themselves they receive information perhaps if they're at a clinic in a waiting room, but they say all we ever hear about is HIV. No one talks about the other STIs, the other infections that you can get sexually. So there is this kind of gap in knowledge. And South Africa has done a wonderful job in destigmatizing HIV, in working with HIV programs. There have been huge gains in that area, but it seems like other STIs have also sort of, as a result, become a little bit of a neglected topic. And while many of STIs are curable, unlike HIV, they can have serious long-term consequences, like infertility. Syphilis can, have negative birth outcomes if you have a baby. So there are very long-term impacts, but it seems like the focus on HIV has meant that other STIs and other types of infections have actually been sidelined. So that's partly what we were looking at in this article, was just that this real lack of information amongst young people for incredibly common issues. STIs are incredibly common, but so many young people don't have information, and not only young people, I have to say the general population. And bringing the conversation back to where we were at the beginning, talking about men. Men are some of the most they keep the most silent around their sexual health. There are so many men out there who are suffering from some kind of infection. Maybe it's burning when they urinate, or they have some kind of itching, or whatever it is, and they just do not seek care because they are embarrassed. Generally, men are not good at going to the clinic for any problems they have. So we have a lot of men out there with health issues who are just not receiving health care, and they're too embarrassed to speak to their friends about it. They are too shy to approach their partner, whatever it is. And so that is really, this culture of silence, I would say, is made even stronger when it's combined with masculinity. To admit that you have an infection in your genital area is just, so many men cannot do that. So it's a real issue, to kind of increase people's information, but also to enable them to seek help, to create these spaces where it doesn't have to be embarrassing, and you can do this in a confidential manner, to ensure that you don't have long-term health issues.
Okay, no, thank you so much for that. As we wrap up, I think you've actually partly answered the question that I was going to ask next, because it's on boys and men being included in conversations about sexual responsibility and stigma. I was just wondering if they are included enough or should be included in those conversations. But you've just touched on that. But I really do wish to see South Africa getting to a point where really young men, in particular, young boys, take part in these conversations, because most often than not, even with programs that are introduced in certain spaces, the focus is on women, yes, but your males would be excluded. Would you say that young boys and young men are included enough in conversations about sexual responsibility?
Definitely not. They are not included enough. And this is a real gap. And as I pointed to earlier, we haven't done much research or work with young men and boys. And this is something that really does need to be focused on. And sort of gender transformative interventions, where both girls and boys are engaged in conversations about gender expectations, about consent in relationships. One worrying thing is that a lot of young people are accessing sort of pornography and things like that on social media, on the internet, and they are learning. They are coming into their sexuality as adolescents, but they are learning from this kind of environment. And often that is quite violent and aggressive, and they are sort of being modeled this very specific type of sexuality. And so the expectations around what it is to be a man, young men that we have spoken to speak about sort of getting approval from your peers by having, a lot of girls, a lot of sexual partners, or, that you say you didn't use a condom, these kind of ideas of what it is to be a real man. And those kind of expectations and norms really need to be challenged, so that we look at sort of healthier masculinities where young men are not encouraged to show their masculinity by any kind of violence or power over women or sexual prowess, because I think that is a big issue. So in answer to your question, there is definitely not enough being done with men and boys, and that's something that we would love to focus on more, and we will continue to seek funding to have this kind of program to engage boys and men more in this conversation.
And does your work involve working with various healthcare facilities around the country?
Yeah, so we have, our projects are funding based. So it really depends on a specific project, but we look across South Africa, and most of our research is from many South African provinces. And we try to look at a mix between urban and rural settings as well. And we have done a lot of work with healthcare workers, and currently actually doing a project looking at kind of knowledge and attitudes towards PrEP is a medication you can take daily to prevent you getting HIV. So it's taken by HIV negative people. So we are looking at healthcare workers' views and perspectives about PrEP, and providing that, because healthcare workers are really the backbone of access to health amongst South Africans, but they are often overburdened. Clinics are very busy. They are under-resourced. So it's really important that these are the people on the front line working in the health sector, but there is also a lack of support. There's a lack of training. There's a lack of resources, which ends up that the healthcare provision ends up being substandard as a result of that. So that is another issue.
Yeah, challenges are endless, eh?
They are, but there is some hope. When we do see some programs being successful, we see young people who are empowered to make healthy decisions about their lives. So when we see that something is working, funding is a challenge, and particularly recently, given the global changes in funding across, particularly in the healthcare sector, it has been a challenge. But there are positive projects, and the South African government is doing a wonderful job in some respects. And so we just continue to try and provide the evidence of what works and what doesn't work, and that's really the focus of particularly our unit, and the Health Systems Research Unit, is what can we do to improve the systems around health, so that people across South Africa amongst all different communities can live healthy lives.
Okay. And if a young girl is listening to this podcast and say is instance currently afraid or ashamed to seek for help, what would you want them to hear today? Well, suppose that they are seeing some symptoms, but they're just scared to reach out. What would you like them to hear?
I would say you're not alone, and it's nothing to be ashamed of. And it's really important that you do seek help. And, the best thing is to go to the nearest clinic to you, and describe your symptoms and get a test if needed, and get treatment. And I think to empower yourself with information. Look it up on the internet, but know that that information might not be accurate, or go to a trusted resource where you can get good information. But the biggest thing is don't suffer alone, and don't be silent about what you're facing, because that's going to impact you in the long term. So it's nothing to be ashamed of. Just reach out and get the help you need.
Lovely. And the second last question, if you look at your media platforms, I will include BTH here, podcasts generally. How they contribute in normalizing conversations about sexual health?
Mm. Well, yeah, I mean, thanks to you for having these conversations and making space for this on your show. And that's why we at the South African Medical Research Council, we are an academic, we do academic research, scientific research, but our focus is really on knowledge translation, on translating the scientific findings, which of course we publish in scientific journals, but we really try to also reach the public with the findings and the implications. We do work with policymakers to try and impact policy changes, but it's also really important, and that's why we work with media outlets, and particularly, for example, Bekasisa Health Journalism for us has provided a great platform to make these conversations, put them out there into the mainstream news, because otherwise they just don't get spoken about. So I have to take my hat off to you for creating space for this conversation and inviting me to speak on these topics, because this is how we normalize, how we break down the stigma and the shame, is by having these open conversations about these topics and not letting them sit in silence.
Thank you. Thank you so much for that, Zoe. I know I said that was my second last question, but the real second last question, thanks to you, is only coming now. And at the mention of policymakers, it would be interesting to know if you think they are treating issues, if I may refer to it as an issue, issues like STIs with the same urgency as HIV, or
Mm.
if STIs and other infections are being overlooked in public health planning.
Well, it's a good question. I think I don't work with the department for the Department of Health. We try and work closely with them. They are always very interested and great at engaging with us on our research. And I think just we know part of the reason we actually focused on this STI, the sexually transmitted infection paper, was because there was a call for understanding more, because there was very little research focusing on sexually transmitted infections, particularly amongst the age group of young women we were looking at. So we really wanted to understand the context. So I would say that the interest is there. And that's what really we try to do, is create the evidence, because you can't make policy decisions, you can't, make changes in health policy without it being backed up by evidence. So that's kind of a crucial part, is what we're trying to do, is create the evidence, is to build that kind of evidence base for making these decisions. So I think there is the health policymakers do, policy can be slow to change and slow to implement, but they are very willing to engage on these kind of findings. So it's very positive, and I think that there is a recognition that STIs do need to be brought more onto the agenda, and make it easier for people to access STI care.
No, thank you for that. And finally, if there was to be progress, I don't know how to frame this question really, but what would real progress look like 10 years from now if South Africa truly confronted the shame surrounding girls' and women's sexual health?
Wow. What would progress look like? I would say I would love to see a situation where it is not shameful to speak about your sexual health, and particularly around, young people, and actually not only young people, but people of all ages. We don't speak about our physical bodies very openly and with confidence, and that can create all sorts of stigma and shame and secrecy. So I think by having these kind of conversations to equip people to safely speak about their health and their bodies, um, I think that would be a really important way forward so that there is good communication. I would love to see better communication between parents and caregivers and young people. And that starts, from very young children to equip them with the tools to talk about their health and their bodies. That will also encourage conversations around consent and, young people understanding what is okay and what is not okay. Um, and I think that's, I would love to see that those kind of conversations have happen where there is no longer this silence, that if I am a 14-year-old girl, that I am not scared of speaking to my mother, my auntie, my older sister, and I'm not scared of going to the clinic and speaking to a nurse about my sexual health. So I think that would be the
Hmm.
the perfect scenario.
Hmm. Well, Zoe, thank you so much for joining us on BTH with Dr. Q. I think this has been a very insightful conversation, and I believe that whoever gets to listen to it will share the same sentiment. I think,
Great. Well, yeah.
yeah. When I went through the article, there's a part where you said that silence is as deafening as it is dangerous, and I think really, the more we speak out about such, we really are going to see some positive changes. We're going to see young girls and women voicing out important concerns that can be addressed. So I thank you for the work that you and your team do. Really, it should not be taken lightly.
Well,
And
thank
that,
you so much for
mm,
having me on your show and yeah, creating space for this really important conversation. So thanks again, Dr. Q, for having me.
thank you very much.
Great.